Many people notice that by the afternoon their legs begin to feel unusually heavy, slightly swollen, or simply tired in a way that wasn't common in earlier years. This is especially true after the age of 70, when natural changes in the body begin to influence how blood moves through the lower limbs. It's easy to assume this is just a normal part of aging, something to accept like slower mornings or needing more rest. However, what surprises many older adults is that this discomfort is often not caused by the heart alone or even major blood vessels. Instead, a lesser-known factor plays a key role: the small but powerful muscles in the lower legs. These muscles, especially in the calves, act like a support system for circulation. When they lose strength or are not used effectively, blood can begin to pool in the lower legs, leading to swelling and discomfort. The good news is that this process can often be improved with simple, targeted movements that gently reactivate these muscles and help restore more natural blood flow patterns over time. In medical training, there is a long-standing concept that the calf muscles function almost like a second pump for the lower body. Each time these muscles contract, they help push blood upward toward the heart, working against gravity. When this system is active and strong, circulation tends to remain steady and efficient. But when these muscles weaken or are used less frequently, blood flow slows down, especially in the lower legs and around the ankles. This can lead to sensations such as tightness, aching, or visible swelling. Many older adults are surprised to learn that improving this system doesn't require intense workouts or complicated routines. In fact, gentle, consistent activation of these muscles can make a meaningful difference. The key lies in understanding how to re-engage them in a safe and controlled way, allowing the body to gradually regain its natural rhythm without strain or discomfort. Research over the years has continued to support the importance of targeted muscle activation for improving circulation in older adults. Studies have shown that even simple movements, when performed regularly, can enhance blood return from the legs. Participants in these studies were not engaging in strenuous exercise programs. Instead, they practiced controlled, low-impact movements designed to gently stimulate the muscles responsible for circulation. Over time, many experienced noticeable improvements in how their legs felt, including reduced swelling and a lighter sensation during daily activities. This highlights an important point: effective movement does not need to be intense to be beneficial. Often, the simplest exercises are the ones that create the most sustainable improvements, especially when they are easy to perform consistently and fit naturally into daily routines without causing fatigue or discomfort. Walking is often recommended as a general form of exercise, and it certainly offers many health benefits. However, walking alone may not always provide the specific stimulation needed to fully activate the calf muscles, particularly later in life. This is because the movement pattern of walking can become shorter and less forceful, over time, reducing the effectiveness of the muscle contractions that support circulation. As a result, even individuals who walk regularly may still experience leg heaviness or swelling. This is why many health professionals suggest adding simple, targeted exercises that focus directly on the muscles involved in blood flow. These exercises are not meant to replace walking, but rather to complement it, ensuring that the muscles responsible for circulation receive clear and consistent signals to stay active and engaged. One of the most effective ways to begin improving leg comfort is through a gentle seated movement that focuses on the calf muscles. This exercise is often recommended as a starting point because it is safe, simple, and does not require standing or balancing. Sitting comfortably in a chair with both feet flat on the floor, you slowly lift your heels while keeping your toes in place. This small motion causes the calf muscles to contract and relax in a controlled manner. Although it may seem too easy to make a difference, this movement directly targets the muscles responsible for helping blood move upward through the legs. Practiced regularly, it can begin to restore a sense of lightness and reduce the feeling of pressure that often builds throughout the day. When performing this seated calf movement, the focus should always be on control rather than speed. Slowly lifting the heels, pausing briefly at the top, and then lowering them back down allows the muscles to work more effectively. Rushing through the exercise or bouncing the feet can reduce its benefits and may even cause unnecessary strain. It is also important to maintain steady breathing throughout the movement, as holding the breath can interfere with circulation and lead to lightheadedness. For those who experience mild cramping, reducing the height of the lift or taking short breaks can help make the exercise more comfortable. Over time, consistent practice can lead to noticeable improvements, making the legs feel less tight and more responsive during everyday activities. After becoming comfortable with calf activation, the next step involves gently introducing movement at the knees and ankles. This helps extend the benefits of improved circulation beyond the lower legs and into the joints above. While seated, one foot is slowly slid backward toward the chair, bending the knee, and then gently extended. Forward again. This motion encourages the surrounding muscles to contract and relax in a smooth pattern, supporting the continued movement of blood through the legs. Many older adults spend long periods sitting with minimal knee movement, which can contribute to stiffness and slower circulation. By restoring this natural bending and straightening action, it becomes easier to maintain comfort and reduce the buildup of fluid in the lower limbs. This sliding movement should feel smooth and relaxed, never forced or uncomfortable. The goal is not to push the joint to its limits, but rather to reintroduce gentle motion that keeps the tissues active. Placing the hands on the sides of the chair can provide additional support and stability. If any discomfort is felt in the knees, reducing the range of motion can help ensure the exercise remains safe. Over time, this simple activity can make everyday movements like standing, walking, or climbing steps feel more natural and less strained. It also reinforces the idea that small, consistent actions can have a meaningful impact on how the body functions as a whole. As the legs begin to respond to these seated exercises, it becomes helpful to gradually reintroduce standing movements in a controlled and supported way. One effective approach is a gentle weight-shifting exercise performed while standing behind a sturdy chair or near a stable surface. With both feet placed comfortably apart, weight is slowly shifted from one leg to the other and then back to the center. This movement is subtle and does not involve lifting the feet or testing balance. Instead, it teaches the body how to distribute weight evenly and smoothly, which is essential for both circulation and stability during daily activities. Weight shifting plays a crucial role in how the body moves throughout the day. Every step, turn, or adjustment in posture requires the transfer of weight from one leg to the other. When this process becomes uneven or hesitant, it can contribute to stiffness and reduced circulation. Practicing controlled shifts helps the muscles contract rhythmically, encouraging blood flow without placing excessive demands on the body. It also builds confidence in standing, which is particularly important for individuals who may feel uncertain about balance. Keeping the movement slow and steady ensures that the exercise remains both safe and effective. Once confidence in standing begins to improve, the next step involves a movement that closely resembles everyday life, rising from a chair. This action engages multiple muscle groups at once, including the calves, thighs, and hips. Starting from a seated position, the body leans slightly forward to bring weight over the feet, and then slowly rises to a standing position. After a brief pause, the movement is reversed, returning to a seated position with control. This exercise not only supports circulation but also strengthens the muscles needed for independence in daily tasks. The sit-to-stand movement is something most people perform many times each day, often without thinking about it. However, when it becomes difficult, individuals may begin to avoid it, which can lead to further weakness and reduced mobility. Practicing this movement slowly and deliberately helps rebuild strength and reinforces healthy circulation patterns. Using the hands for support when needed is perfectly acceptable and can make the exercise more accessible. The emphasis should always be on smooth, controlled motion rather than speed or repetition. As strength and coordination continue to improve, combining these elements into a single flowing movement can provide even greater benefits. One such exercise begins in a standing position, with hands resting lightly on a support surface. The movement starts with a gentle lift of the heels, activating the calf muscles, followed by a slight bend in the knees and a return to standing. This sequence brings together muscle activation, joint movement, and weight transfer in a way that closely mirrors real-life actions. This combined movement is particularly effective because it encourages different muscle groups to work together in harmony. When the calves, thighs, and hips engage in a coordinated manner, circulation becomes more efficient and consistent. The exercise should be performed slowly, with attention to balance and comfort. There is no need to deepen the knee bend or increase intensity. Instead, the focus remains on steady, confident movement that can be repeated daily without strain. Consistency is one of the most important factors in achieving results from these exercises. Practicing them regularly, even for short periods, allows the body to gradually adapt and improve. Many older adults find that within a few weeks, their legs begin to feel lighter and less fatigued. Activities such as standing, walking, and sitting for extended periods may also become more comfortable. These changes are often subtle at first but can build over time into meaningful improvements in overall mobility and well-being. It is important to remember that progress does not come from pushing the body beyond its limits. Instead, it comes from working with the body in a way that respects its current abilities while gently encouraging improvement. Each exercise builds upon the previous one, creating a progression that supports both circulation and strength. By focusing on controlled, mindful movement, it becomes possible to enhance function without increasing the risk of injury or discomfort. Improving circulation in the legs has benefits that extend beyond physical comfort. Better blood flow can support balance, reduce the risk of falls, and increase confidence in movement. These factors are essential for maintaining independence and quality of life. When the legs feel more reliable, it becomes easier to stay active, participate in daily activities, and enjoy time with others without constant concern about discomfort or fatigue. Another important aspect of these exercises is their accessibility. They do not require special equipment, gym memberships, or large amounts of space. Most can be performed at home, using a simple chair for support. This makes them easy to incorporate into daily routines, whether while watching television, taking a break, or preparing for the day. The simplicity of these movements is part of what makes them so effective, as they can be practiced consistently without added stress or complexity. Over time, these small, consistent efforts can lead to meaningful changes in how the body feels and functions. The legs may become less prone to swelling, more responsive during movement, and better able to support daily activities. This gradual improvement reinforces the idea that aging does not mean losing control, but rather adapting in ways that support long-term health and comfort. Ultimately, maintaining healthy circulation after 70 is less about intensity and more about awareness and consistency. By gently reactivating key muscles, restoring natural joint movement, and practicing simple standing exercises, it becomes possible to support the body in a sustainable way. These practices encourage confidence, independence, and a greater sense of ease in daily life. Taking a few moments each day to focus on these movements can make a lasting difference, helping the legs feel lighter, stronger, and more capable over time.